Dr. Manchikani had asked me to be one of the reviewers some years ago, and I just was doing my job, reviewing articles, and I think it was almost a decade ago, he gave me a call on a weekend and asked if I would like to be the editor-in-chief. And after I clarified that it wasn't a prank, I said I'd be happy to do it. And it's been a great opportunity for me looking at incredible articles from around the world and looking at them with a critical eye and making decisions on what would be the best articles to publish in our journal, which is now one of the premier top interventional pain journals in the world. It's peer reviewed. We usually have 3 or 4 different people who review each article. They are sent through our section editors. The journal is divided into many different parts. And so there are incredibly diverse topics that are available to the reader, and the best thing about it is it's free. So it's easy to access on the internet, and if you'd like it mailed to you, you can get a subscription. But it provides not only cutting-edge articles and investigation, but it has health policy, it has various focuses, and I think for me, the best thing is we have guidelines. Those guidelines are made with a lot of help. They usually take a few years to review all the articles on a topic, such as anticoagulants, such as opiates, interventional pain procedures, and then it really dissects down into treatments and the evidence for those treatments. So are those particular treatments of high, medium, or low validity based on prospective studies, case studies, or studies that are really poorly done and really show little, if any, evidence for a particular therapy. And our readers, which are in the tens of thousands around the world, really look to those guidelines as a model of best practice. And as I said, the people involved in making these guidelines, it's not one person. It's really dozens and dozens of people who spend considerable time looking at all the world literature. So at today's National ASIPP meeting here in Las Vegas, I was presenting the guidelines for antithrombotics for interventional pain physicians, and I was describing this 75-page document that was put together by a few dozen people. And those articles, case reports, different investigations that are in the literature went back to the early and middle 1960s. So it was an incredible effort by a lot of people to get a comprehensive guidelines that reflected not only on Plavix, aspirin, nonsteroidals, but touched on herbals and other things that can mediate or modulate a blood thinning effect, which is not something that we want to have as a result or a consequence, an epidural hematoma, for example. On the back end, if we don't have good recommendations, guidelines, people can end up having a stroke or a heart attack because they're not on their medications to prevent those conditions. So I think it's really tremendous, these guidelines that we have. They're really, well beyond a typical article that you'll read that might be 5 or 10 pages. They can be over 100 pages in length. Facet guidelines, procedures of the spine, diagnosis and treatment, and then outcome studies. Because it's not just doing them, how do you do them? What medicines do you put in there? It's really a tribute to our world of scientists, clinicians who've done these studies that we can consolidate them into these very important guidelines. I'd say that we have as a guideline to the guidelines. We typically update them every 2 or 3 years, and there are probably anywhere from a dozen to 20 different topics that we've been able to organize. And one of the newer ones that evolved that we didn't have previously is on regenerative medicine, the whole field of delivering stem cells or your own other additional blood products into your own body to help regenerate tissues and to ideally improve pain. It's every month, and as I said, it's accessible on the internet for no charge. Because of that, it's become very popular. It has a very high impact factor, one of the top impact factors for pain journals in the world. And our submissions have grown to thousands a year. 10, 15 years ago, it was a smaller number, but there's definitely been a tremendous interest worldwide for people doing research, reviews, meta-analysis of other articles in the world literature to publish in the Pain Physician Journal, which is great for all of us as we try to develop our own best practices and certainly do things safe, effectively, and do the best we can for all of our patients. There are guidelines, they're called author guidelines, and they're very detailed in how to go and submit the formula from an abstract, throughout. The references have to be of a certain style, and it's very easy to submit. It probably takes from the time that you have your article ready in the right format to downloading it into our system, perhaps 15 or 20 minutes in total. The journal is one of the very best things that we have at ASIPP in terms of education and clinical practice. There's a part of it that is focused on basic science, and of course there's another part that's focused on clinical science. There are topics, as I said, from health policy to radiology, new drugs, and all the rest. It's really well designed and comprehensive. I hope that everyone who's listening to this will look at it on a regular basis and recognize how wonderful it is for pain practitioners and for people who want to know more about their own pain states. We always are looking for reviewers. If you're interested, you can send your resume out to Savannah Gold or myself. Our emails are on the website. We typically, to be a reviewer, we would like you to have at least 30 published articles in your own resume, which will give you the perspective on if an article is good or bad. That's been our standard now for all of these 9-10 years that I've been in this role. Thank you very much for having me, and thanks for the opportunity to talk about the Pain Physician Journal and guidelines and all of the great things that ASIPP has to offer.